It started with my right hip. My right hip was hurting real bad. But I love playing basketball, so I just was trying to play through it.
He didn't tell me about it. So I was like, are you okay? Are you okay? And he was like, yeah, I'm good.
I was a sophomore, so I was competing with older players to get the varsity spot. So I knew, like, if I made an excuse, he was gonna think I was scared or something like that. So I just tried to play through it, and it got worse and worse and worse.
My wife set up the appointment for him to see Dr. Salata. He saw Dr. Salata, and they did the x-rays and everything, and Salata told him, he had a torn labrum.
The diagnosis that Kyle has is a condition called femoral acetabular impingement, or FAI. And FAI can be notoriously difficult to diagnose. So we have the benefit of treating a lot of young people with hip pain. And so for us, oftentimes the diagnosis is pretty straightforward, but it can be a little bit of a challenge out in the community. There are a lot of athletes that this can be a career ender for them if it becomes too painful.
Oh, it was real hard. Like, we talked about it at night. I mean, he ain't gonna admit it, but he was in tears, because he was thinking, like, man, this can't be the end. This is something that he's been working for since he was in like 3rd or 4th grade. Like, this is all he's dreamed about, and that's all he's talked about.
A lot of credit for our athletes' recovery always goes to them. So the kids are always really hard workers. They want to be great, and they're going to be great, and that's a testament to their will and their skill level. And so our job is really just to help enable them to achieve what they're able to achieve.
If he wouldn't have had the surgery, he definitely wouldn't have made varsity that year. He definitely wouldn't have started. He wouldn't have been as agile. He probably wouldn't have been playing basketball right now.
Before my surgery, I was a terrible defender, and my coach would always bash me for it, saying I was slow, wasn't quick enough, and I'd never play at Division I level. But after my surgery, I was quicker, faster, lateral movement was better.
It was looking dark. It was a dark part of his life, and he thought it was over for him, and they gave him a second chance.